How to meet expectations of journal editors and peer reviewers.
The single most important thing is a manuscript that clearly reports a study that helps to answer a clearly stated question that our readers and their patients want and need an answer to.
The first thing we're looking for is truthfulness.
Editors and peer reviewers are typically people that have a lot of experience in writing good papers, and they should not be viewed as your adversary. But as you get a paper moving through the process towards publication, think about them as working on the same team as you are in, getting your paper to the point where it's ready for publication.
Both journal editors and peer reviewers aim to publish meaningful research that is aligned with the interests of their readership. To meet those expectations, it is essential to critically evaluate your research to determine what it adds to the body of evidence in the field. Begin with asking the question, what does my research add to the body of evidence? Then, in 2 to 3 concise sentences, summarize the purpose, importance, and novelty of your research. Consider the existing body of evidence in the disease state or research field. Are previous findings confirmed? What does your work contribute? Keep in mind that your research may raise questions that could influence future research in the field. Ensure that the content of the manuscript remains focused on these key points. When reviewing submissions, editors and peer reviewers consider if the research will be of interest to the journal readership. To help tailor the content while developing your manuscript, consider who will want to read about your research and what information they will need to fully understand and appreciate the findings. For example, a manuscript submitted to a specialty journal may include technical nuances that are specific to the expertise of the audience, while a manuscript submitted to a general medical journal should be understandable and relevant for a broader audience. Choose a journal whose readership aligns with the audience you have identified and whose aims and scope align with your research. When reviewing your submission, journal editors and peer reviewers will be asking, is the manuscript focused and does it have a logical flow? Let's start by looking at the overview of where key summary statements should be reinforced throughout your paper. Your statements summarizing the purpose, importance, and novelty of your research should be visible in the abstract, in the introduction, and at the beginning and end of the discussion. This placement will naturally remind the reader of the main purpose of the research. While this approach may seem repetitive, when you write, also consider how published research is read. Readers may not read the entire article, and some redundancy in content may be helpful. For example, if the topic is unfamiliar, readers may appreciate repetition of key points to avoid having to backtrack and remind themselves about the details. Now, let's focus on specific sections of the manuscript, beginning with the introduction. Build the introduction with only the most essential information required to understand the unmet need, the research problem, and its relevance to the field. Reviewers are seeking clarity and brevity that will help them understand the manuscript's key findings and place those findings in context with the larger body of evidence. Get to the point quickly without distracting details. Only include information directly needed to interpret the purpose and results of your research. Avoid the temptation to turn the introduction into a mini review article. This section should be limited to 3 to 4 short paragraphs. In the methods section, you should describe only the study design and methodology for data gathering and analysis. The methods section should be written in the past tense and should not provide a preview of the results. Primary publications should include details on the patient population and study conduct. When reporting secondary, retrospective, or post-hoc analyses, help editors, peer reviewers, and readers make the connection back to the primary report of the study by clearly citing the original paper and include any trial registration numbers and persistent dataset identifiers. In the results section, describe your findings in an objective and factual manner. Avoid mixing methods and results. At initial description, present the results without interpretation. This approach allows the reader to review all of the results before exploring their potential relevance to the field within the discussion. In the discussion, interpret your results, but remain objective and do not overstate the conclusions. Clearly state the limitations of your research, which will enhance the credibility of your work and make it easier to understand and interpret. Focus on placing your research in context with other published data in your field. Be conscious of introducing personal or commercial biases. Peer reviewers are specifically reviewing for bias and are obligated to comment if any are found. Another important aspect that journal editors consider is manuscript formatting. A properly formatted manuscript may encounter fewer roadblocks during its journey through the submission, peer review, and acceptance processes. Following journal guidelines may avoid a costly and time-consuming resubmission. Locate the journal guidelines on the author information page, sometimes referred to as instructions for authors. From the journal guidelines, identify the correct article type and specifics relating to the abstract structure, general manuscript flow, including major headings and word count requirements, as well as file formats for submitting artwork or figures, and formatting of the references. Finally, be sure you understand how to disclose conflict of interest and funding information. Some journals will administratively reject manuscripts that do not follow guidelines without sending to peer review. By following journal guidelines, your manuscript will more easily fit into the process and workflow of the journal and journal editor. As an author, the last thing you want to do is make it difficult for a journal to accept good research. Important supportive documentation that is not critical for interpretation of the main research findings should be considered for inclusion as supplemental content or supplemental materials. As a final sanity check, compare your manuscript to a similar, already published article in your chosen journal for content as well as organization and format. In the end, what are journal editors and peer reviewers both expecting when they review your manuscript? They both want to review concise, accurate, and objective manuscripts that advance their field of interest. In addition, journal editors need to ensure that the research fits the aims and scope of their journal, is properly aligned with the journal style, and will appeal to their readership. Authors should make sure their manuscript submissions meet these expectations. Resources to help you develop a manuscript that meets editor and peer reviewer expectations are available on the MPIP website and those of other organizations shown here.